ANUSHRI Agrawal, and I'd like to thank everyone for giving me this opportunity to present my free paper, which won the best award for the cornea in the last conference. So today I'll be talking about suturing technique in DALK for patients with keratoconus for a better visual outcome. As we all know, keratoconus is a degenerative, non-inflammatory corneal disorder characterized by progressive stromal thinning and ectasia. And in the more advanced cases, especially those with apical scarring, need surgical intervention. And deep anterior lamellar keratoplasty has increasingly been advocated as a reliable alternative to penetrating keratoplasty for the treatment of these cases due to advantages like mitigation of endothelial rejection, lesser need for postoperative steroids, early suture removal, etc. But why this study? So in our experience, we found that the patients of advanced keratoconus who underwent DALK, even though they had excellent surgical outcomes post-surgery with keratometry readings of around 44-45, in due course of time, their keratometry readings would go to over 50. Hence, we tried this new technique of donor trimming and suturing in order to maximize the visual outcome in patients with advanced keratoconus. So 70 consecutive patients who underwent DALK for advanced keratoconus were included in the study, and they were followed up for a period of minimum of 2 years. Lamp examination, uncorrected and less corrected visual acuity with refractive correction and corneal topography using pentacam were noted at each of the follow-up visits. All the surgeries were performed under general anesthesia. After reaching the desired depth, big bubble was achieved using a 27-gauge cannula. This was followed by debulking of the superficial stroma and excision of the remaining stromal layers with the help of blunt scissors. This was followed by the graft preparation. Since we believe that the peripheral rim of host cornea could be around 450 to 500 microns, we hold the donor graft at its posterior edge, and in order to match the thickness of the peripheral host rim, the posterior edge is trimmed as shown in the video. With this, we believe that there will be a better matching of the thickness of the graft to the peripheral host rim and leading to better apposition at the graft host junction. This is followed by suturing of the graft over to the host descendants membrane. The knots are tightened so as to nicely flatten the graft over the host DM. During this course, we should also take care that any folds that form in the host descendants membrane need to be ironed out, especially if they are in the visual axis. Lastly, we believe that we need to replace the cardinal suture in order to provide that adequate flattening effect from the graft. Finally, all the 70 cases were analyzed. Coming on to the result, the mean preoperative visual acuity was around 1.219, which improved significantly post-surgery and was valued around 0.625 at 6 months, 0.518 at 1 year, and as good as 0.394 at 2 years. Also, the mean spherical equivalent was minus 8.47 preoperatively. And since the graft was nicely flattened over the host descendants membrane, as expected, we found a hyperopic state in the immediate postoperative period, which gradually progressed towards a more emetropic state with spherical equivalence of minus 1.14 at 2 years. The average keratometry value was 60.2 preoperatively, which improved significantly, and at 6 months, it valued at around 43.2 and started to stabilize with values of 44.1 at 1 year and 0.5 at 2 years.
Where cytokine as well as the fluorescent cytokine. With that, introduction of the graph, which is from the experiment in similar. Now,
So to conclude, we feel that trimming the peripheral posterior edge of the graft tissue helps in better apposition at the graft-host junction. Also, since the graft was nicely flattened over the host descemet membrane, it can counteract any progressive steepening effect from the peripheral rim of the ectatic host cornea. Hence, we believe that this novel technique of donor trimming and suturing can be an effective measure of improving the post-operative visual outcomes for deep anterior lamellar keratoplasty in advanced keratoconus patients. Thank you.